Ladies and gentlemen, you're currently on hold for today's Foundation for a Healthy Kentucky Free Health Resources Conference. At this time, we are still meeting additional participants and do plan to be underway momentarily. We appreciate your patience and ask that you please remain on the line. Please stand by. We're about to begin. Good day and welcome to the Foundation for a Healthy Kentucky Free Health Resources Conference. Today's conference is being recorded. At this time, I'd like to turn the conference over to Ms. Rochelle Seeger. Please go ahead.
Good afternoon, everyone. This is Rochelle Seeger. I work at the Foundation for a Healthy Kentucky as a Community Health Research Officer. And I'm thrilled that you joined us this afternoon on this beautiful sunny day in Louisville to hear about some of the free resources available across Kentucky. The Foundation for Healthy Kentucky is a nonprofit philanthropic organization created in 2001 with assets from a settlement agreement as a result of the merger between Anthem and Kentucky Blue Cross and Blue Shield. The Foundation for Healthy Kentucky's mission is to address the unmet healthcare needs of Kentuckians, and we do this by developing and influencing policy, improving access to care, reducing health risks and disparities, and promoting health equity. Here at the Foundation, I work on the data initiatives. That includes a website, KentuckyHealthFacts.org. I also work on the Kentucky Health Issues Poll, an annual telephone poll that's jointly sponsored by Interact for Health. And I work on this, the Health for a Change training series. This training series was begun in 2011, and we've had representatives from every Kentucky county join this Health for a Change training series. The training series is a capacity building workshops and webinars to support nonprofit leaders across Kentucky who are working to advance today's pressing health issues. So we want to hear from you. What do you need? What are you looking for in these training series? You see the website on the top of this page, healthykentucky.org, and all of the archives of Health for a Change are there on the website. So if you're logged into our webinar via your computer, we have a poll question for you to get started. It says, have you considered what training or resources your organization or health coalition needs? Here are some choices. No, I haven't. Yes, occasionally I've considered these things. Yes, frequently. If you want to log in and think about your training resource and needs. All right. So most of us on the call, 70% are thinking about these occasionally. So that's great. So those people that aren't thinking about trainings did not join us today. Important. So share these trainings with your friends and neighbors who may be interested. You can see we have a great schedule of upcoming webinars. May 9th, we'll have a data sharing webinar. May 23rd, we'll have a grant writing webinar. And on June 20th, we'll have a health equity webinar. Also in May, we have 2 great workshops upcoming. May 10th will be at Muhlenberg County Extension, and May 17th, we'll have an in-person workshop at Clark County Extension. The title of the workshop is The Art of Working with Others, Creative Strategies for Community Health Coalitions. And the Foundation for Healthy Kentucky is proud to sponsor these workshops in partnership with CEDIK, Kentucky Cancer Consortium, and the Kentucky Department for Public Health Partnership for a Fit Kentucky. So if you're nearby, you can come join us those days. The registration is open. Next up, I just wanted to tell you about the Foundation's websites and social media channels. I tweet out of Kentucky Health Facts, and we have a Healthy Kentucky Twitter feed and also a Facebook page for the Foundation for a Healthy Kentucky. Just a reminder that this webinar is being recorded, and you'll have access to all of the slide decks from our great lineup of speakers that we have for you today. Here's the Foundation's website, healthy-ky.org. My last announcement before we get started is the Foundation for Healthy Kentucky has a building here in eastern Jefferson County. We have a conference facility. That's available for organizations just like yours to have trainings or meetings here in eastern Jefferson County. If you check on our website, you'll see a conference facility page, and on that page there's a form for inquiries about available dates. We'd love to host you here in eastern Jefferson County. We have 4 great speakers. I've worked closely with each of these organizations, and I just wanted to share all of the great work that they're doing, so I'm grateful that they joined us on the call today. And now our first speaker is from CEDIK, and I'm welcome to the call Melody Nall. Go ahead, Melody.
Thanks, Rochelle, and hello, everyone, and thanks again for the invitation. I am Melody Nall, and I'm the Engagement Director with CEDIK, and that stands for Community and Economic Development Initiative of Kentucky, and we are housed at the University of Kentucky. And some people say, well, who is CEDIK? And I'm going to start off by saying our acronym is CEDIK. We like to say it rhymes with medic because it can be confusing sometimes with how to say it. We began in 2010 in the UK College of Agriculture, Food and Environment as an initiative. Allison Davis, an Ag Econ professor, is our executive director, and she has grown this organization from herself and Sarah Boker, who was the first employee, to now we have 4 faculty, 12 full-time staff, 2 grad assistants, and 2 undergrad assistants. Our mission for CEDIK is to catalyze positive change to build engaged communities and vibrant economies. And our vision is to have empowered people and thriving communities. We have quite a variety of backgrounds and professional degrees among our staff and faculty. And I will just say that we have expertise among regional planning, public administration, curriculum development, community health, arts education, and small business development. We use our expertise to work with extension agents to do community-level, community economic development work, as well as doing other statewide and non-extension projects. Today I'll be sharing some work on our pillars and to let you know we do more than just work in a health field. These are our 5 pillars, and they include economic development, healthy communities, community design, community leadership development, and arts engagement. And we use all of these and work under these to help build and meet our mission of engaged communities and vibrant economies. Today I'll be sharing CEDIK services that would be most specific to health networks, coalitions, or healthcare organizations. These include the services listed on this slide: county data profiles, a survey review, specialized data request, community health needs assessments, or I'll refer to as CHNAs, coalition or network development, and grant training. So first up is our county data profiles. This is what we seem to be most recognized for when we're out in communities. This lives on our website, which you will see there at the bottom of the slide. And for each county in the state, 120, we provide the following information. And this is good for you to use for grant applications, sharing with your community, elected officials, however would be helpful to you in increasing your work. We also have on our website a report that is on the value of the local healthcare system on the county economy, which can be very beneficial to communities as well. You'll also see at the bottom of that website that we have links so that you can also find other data profiles or data sets, and you'll also find Kentucky Health Facts there, as well as some of the other partners that are on the call today. But you'll see that our data profiles include agriculture and food, economic overview, education, workforce, retail sector, and small business. These are currently being updated. We're moving to a Tableau format. So over the next year you'll be seeing some changes in how they look, and they'll become more interactive. Customized data request. This is something that we can offer to you. If you're looking for data online and you just can't find it and you don't know where to go, we do have a research department that is very active in finding those things for us, and they have that expertise in locating secondary data sources. And we have access to some data sources that are not just readily available online. Simona Balitz is our research director, and her contact information is on this slide, or you can always feel free to contact me as well. Something else that Simona will do for us and for you is she is our resident survey reviewer. Her research experience allows her to review survey questions and determine if they're written in a way to get the information you're seeking. Sometimes it's just a tweak of a word or two, and it can create a really solid question that will give you the results you're looking for, because while surveys are great, the information gathered is only as good as the design of the survey and your process for collecting that information. So once again, if we can help you with that, let us know. It is a review. She can't create your survey, but with enough lead time from when you need to implement your survey, she can provide a review and give you some feedback before you move ahead. Community health needs assessments. This is something that we do and started in 2012 as a result of the Affordable Care Act being passed. We work with hospitals in Kentucky to make sure that they meet their IRS requirements for CHNAs. And recently we're having more collaborations in communities between both a local hospital and a county health department. And we can tailor our process for both organizations so that each receive their process, data collection, and analysis that they need to meet either the IRS or accreditation requirements. So I am the contact for that. You can feel free to contact me if you need more information. There is a fee for that. We do work with hospitals and have a fee structure based on the number of beds that they have, and we also negotiate based on special circumstances as well. And just to give you some feedback, we wanted to share with you some results. This started as a partnership with the Kentucky Office of Rural Health and the Kentucky Hospital Association and CEDIK to help small rural hospitals meet the requirements without undue financial stress. We were getting reports that companies were coming into the state at the beginning of this wanting to charge sometimes upwards of $50,000 to complete CHNAs, and that's per hospital. So we've worked with hospitals now. We're finished the second round, and it's hard to believe, but moving into probably the third round soon. And this is just some data on this slide that we wanted to see what happened in that in-between time. What did they accomplish? And it's good to see that all hospitals increased their community and individual educational programs. You can see there's a variety of topics based on their community needs, and that was diabetes, nutrition, obesity, heart health, cancer, and wellness. Hospitals also increased access to care by adding specialty care, by recruiting physicians or having them come in on specialty clinic days if they weren't there full-time. They also added after-hours clinics either at their campus or in their community. And 10 hospitals also demonstrated that they improved communication, both between providers and patients, regards to billing issues and process, and even simple things like the hospital signs, increasing those to where people knew where to go, and increased education to the public on services that were available at the hospital. We work with networks and health coalitions to help them form. And we also can work with those same coalitions and networks if they run into a point to where maybe they've run out of steam, or maybe a leader has left and they need just some assistance. Sometimes it just takes an outside person to come in and observe or lead conversations that can kind of recharge the coalition to get them moving on to greater success. We also have webinars and trainings that we could provide that would help grow leaders to increase success for coalitions as well. We can also work with your coalition with a process called ripple mapping, which is an evaluation tool. It also provides feedback beyond just numbers. It also gives you a chance to see how your work has spread beyond even what you can see. So think about ripple mapping in the future if you want to see all the broad strokes of your work. We can offer grant training. Allison Davis is our director, and she's a very accomplished grant writer. She is willing to offer these at a regional or local level, and the fees associated are really just to help cover cost of meals and breaks, and to also kind of assure that people will show up when they say they will. So that's on an as-needed basis and per request. This is something that we're exploring right now, and that is board training for nonprofits. And we're trying to explore if there is a need for that, and we welcome your feedback, so much so that I asked Rochelle to put in a couple of poll questions for us. So we will move to the first poll question. And the first one is, has your coalition or network participated in a formal board training that defines roles and responsibilities of partners? You'll just take a couple of seconds there and give us an answer. All right. They're still coming in, but we're looking pretty split right here. We have a little bit heavier to the no's, but it's pretty evenly divided. So I'd say about 60% are no. So thank you. And the next question, do you see a need for nonprofit board training for coalitions or health networks in your area? And if you could just give us a response to that one as well. The responses are no need, we're all trained, possibly, I need to check, or definitely I see a need. Okay, from our responses, we're heavy on the we see a need. That's the greatest number there, with the I need to check falling in next, and only a small number of no, we are not needing training at this time. So thank you so much for that help. We will ask you to stay tuned to know if we need to move ahead with that as an organization. And any feedback you can give us, please contact me. Rochelle has already shared this. I'll let you know that myself and my coworker, Melissa Bond, who is our arts engagement director, is going where we will be presenting this for you along with some special guests. And thank you, and I hope you visit our website and that we hear from you soon. Thank you, Rochelle.
Thanks so much, Melody. I'm going to skip back to the slide you just showed us and remind everyone on the call that there is a stipend available of $250 to organizations who can bring 2 community team members. Elaine Russell at the Partnership for a Fit Kentucky is in charge of that. Please contact Melody or myself, and we will get you the information if you can bring some team members to our upcoming trainings. Thanks, Melody. Next up, we have Sarah Erzman-Patrick from the Kentucky State Data Center. Go ahead, Sarah.
Thanks, Rochelle. Yes, my name is Sarah Erzman-Patrick. I am the research coordinator at the Kentucky State Data Center, and we're housed in the Department of Urban and Public Affairs at the University of Louisville. So today I just want to briefly mention what the State Data Center program is. We're the lead agency in this partnership program that the U.S. Census Bureau developed in 1978 in order to facilitate the use of census data at the local level. So we provide access and education on Census Bureau data and products, but we also are familiar with resources from other federal, state, and local agencies. A big thing that we do have access to also is historic data, so even further back than 1990, which can be difficult to find on the internet, we can help you navigate through some of that historic data as well. We also foster two-way communications with the Census Bureau on data usability, data user needs, and operational issues, so they understand how people are using their data and how it can be improved. And then we, of course, use the data and present findings of demographic and socioeconomic trends throughout the state of Kentucky. So to facilitate data dissemination in the modern era, we have developed this handy website. Long gone are the days of data being disseminated on books or tapes or CDs. So we have it all out here on the internet. And it sort of serves as a portal to other data sources that are available on the web. So the data sources by topic link is a really good place to start when you're looking for data. It is by no means exhaustive, but it's a good place to just sort of broad topics and sort of some of the different data sources that are available, and then how to navigate the sites that you're linked into. We also take data requests if you can't find what you're looking for. Much like CEDIK does, we'll be happy to help you sort of find what you need. So I just want to introduce some kind of high-level topics available from census data. Your research needs might be something kind of simple, like what is the total population living in your service area, or maybe it's the number of children. So all that would come from census data. Maybe it's something like you need to calculate mortality rates, so you need population by age, and so that would come from census data. Maybe you want to describe the social or economic conditions of an area for a grant application, things like educational attainment, income, poverty status. All of that comes back to census data, and even things like the concentration of older housing, if you're trying to target outreach on lead poisoning. Many roads lead back to census data. But census data can be somewhat complicated, overwhelming even. There are so many different census programs and surveys. This table is just showing some of the most commonly used, but there's a lot out there. And so I can help you sort of navigate through the pros and cons of different data sets to find what's most appropriate for your particular data need. So we also engage in sponsored data analysis at the State Data Center, where we'll work with different nonprofit agencies that need a lot of numbers crunched. And while we do charge for those services, what we find is that generally that product is later made available to the public for free. So these are a couple examples of things that we've done recently or on an annual basis. And then there's some good examples of how census data is incorporated into a public health context. So of course, KentuckyHealthFacts.org with our friends here at the Foundation for a Healthy Kentucky. We use population data to calculate age-adjusted mortality rates for different causes of death and fertility rates. Conditions of the social environment are on the website. And so all of that's for counties, area development districts, and the state. For the Louisville Metro Health Equity Report, we did a lot of the same kind of crunching for age-adjusted mortality rates and fertility rates, but these were actually for areas smaller than a county within Jefferson County. We did local area data analysis for them. The Kids Count data book comes out every year, and the good folks at the Kentucky Youth Advocates look at a lot of different census data that's sort of mined in pretty good. So we look at household type, like a lot of different household types, single families, single parent households, and sort of household formation. We look at labor force status of parents, disconnected youth, teenagers 16 to 19 that are not enrolled in school and not working. So all of that actually comes from census data. And then for Metro United Way, we recently did some data profiles for their service area, and some of the more interesting data points that we mined for them are poverty status by age and different ratios of income to the poverty level, housing cost burden, so how much of your income is spent on housing. So we can mine census data to really hone in on a specific research need. At the State Data Center, we also create population projections. So these are predictions of what the population will look like in the future based on a demographic model that incorporates fertility, mortality, and migration rates. So we produce these for the state, for counties, and the area development districts, and they are available to download there on our website. And I also wanted to mention the projections are available by age and gender. So if you have a specific planning need, whether it's schools or senior centers, you can look at that in a more refined way. Another thing that we do at the Census Bureau is kind of help people understand local area geographies, and by that I mean geographies that are smaller than a county. So within a county, how can we look at different neighborhood level data? Because neighborhoods don't actually have a census definition, but there are census tracts that we can use to kind of approximate neighborhood areas. So this little map is showing the Smoketown neighborhood in Louisville with a census tract, so we can see it's a really close approximation. And then once we know what the census tract is, then we can go in and find the data for that. We also help people understand like where addresses are located within different geographies and sort of the relationship between small geographies and larger geographies, because there can be some confusion with that. I also wanted to briefly mention, since I know that there isn't a lot of health data that is available for areas smaller than a county, the 500 Cities Project is a program that came out from the CDC and the Robert Wood Johnson Foundation that publishes health behaviors and outcomes for census tracts. And so data is available for the balance of Louisville and for Lexington. And the primary source for that data is the Behavioral Risk Factor Surveillance System. And there's 27 measures, so if you happen to be working in those communities and want to take a look at some finer grained data that is available. So I know that in a lot of cases, health data available for areas smaller than the county is for zip codes. And so there might be times when you want to incorporate population or socioeconomic data into analysis of zip codes. But zip codes can be somewhat challenging, and so we can kind of help navigate some of those problems. First off, it's helpful to know zip codes are created for the delivery of the mail and not for data presentation. But the Census Bureau created what it calls zip code tabulation areas, also known as ZITCAs, to approximate the area of a zip code. And so these geographic areas, they do have data available, but they can be a little challenging. They can and do often cross county lines and city lines. They vary widely in geographic size and their average population size. PO boxes are a problem because they're not represented in the data. So we can sort of help if you do need to use zip codes, sort of figuring out some of the challenges associated with that data. And I just want to wrap up by quickly mentioning that we have been working on promotion for the 2020 census, and you may have heard that there's some uncertainty whirling around this particular decennial census in terms of funding, but also in terms of the questions that will be asked on the census form and how that might impact response rates. So just to highlight, all of the data I've discussed today relies on an accurate count during the decennial census, not to mention, funding allocation of over $675 billion federal dollars. So we really need to make sure that the 2020 census is a success in Kentucky. And why am I talking to you about it? Well, you might have a role to play because with this uncertainty at the national level, promotion at the state and local level is going to be especially crucial for this census cycle. And it's never too early to start thinking about how you might help, inform a complete count. So there's some applications out there that you can look at to kind of see where there might be hard to count populations. City University of New York developed this hardest to count interactive map that shows census tracts with the lowest 20% of mailbox response rates in the nation from the 2010 census. And there are areas of Appalachia that are represented in that, but also areas in the middle of our two largest cities in Louisville and Lexington. And so how we can target those communities and let them know that it is important and that it is safe to fill out the census, we're going to be calling on all types of organizations, including probably yours, to try to help us get the word out. So the Census Bureau has also developed a response outreach area mapper called ROAM, which also highlights some of the hard to count areas and why they might be hard to count. Characteristics like a high percentage of immigrants with a low English proficiency would be considered hard to count, but then also areas with a high percentage of renters, college students and millennials who might not be engaged with their community can also be hard to count. So just a concluding thought, inaccurate data is a disservice to all of the great work that our agencies do, and it's not too early to start thinking about how to have a successful count in 2020. And with that, I'm going to wrap it up. Our website, I'm available through the website, through the data request link. All of those data requests come to me. I also answer that main phone line, and we are on Twitter. So thanks, and with that, I'll turn it back over to Rochelle.
Thanks so much, Sarah. Great information. So data lovers on the call got a lot of information, and all of us know who to call now. So we have Sarah's direct line. So thank you so much, Sarah, for sharing all of your great work with the Kentucky State Data Center so that we can learn more about what you do. Next up on our call is Kiprick, and I want to welcome Gina McKee to our call. Welcome, Gina.
Thanks, Rochelle. I am Gina McKee. I'm with the Kentucky Injury Prevention and Research Center. We've been a center of safety and injury research and promotion since about 1994. We are a bona fide agent of the Kentucky Department for Public Health, and we are housed at the University of Kentucky in the College of Public Health. We are working under funding from CDC for many of our projects, and that's important because that's where a lot of our data comes from, and so I always need to say who's paying for this. What I'd like to do is to go over what the Kiprick data sources and our technical assistance that we can provide through our programs, and then to talk a little bit about our substance use treatment locator website that we have just gotten started. So we have, and I'm going to say a couple of things right now as disclaimers. This is the front page of our website. Our website is changing servers at this point, so sometimes that gets a little bit squirrely when you're looking at our website. So just close down and try one more time. Usually it will load with a different Google search, and so don't give up on it. We should get those problems cleared up in about 30 days. And second, For the purposes of this and the next presentation, we are actually sitting right on railroad tracks, and we have absolutely no control when trains come by and blare their horns. So if you hear me go mute, you'll know that there's a very loud train, and I'll come back on in about 5 seconds. So here's our website. This is where you can find our reports, publications, projects, and interest areas. And this is where we get our data. We deal primarily with vital statistics from death certificates, hospitalization, billing data, who's going into the hospital for what reasons, emergency department, same thing, and CDC. We get a lot of our data. But we also have other more local state data sets around prescription drugs, workers' comp injury, our own fatality assessment and control for occupational fatalities, crash data, which is motor vehicle information, autopsies, toxicology, and coroner reports. When you look at our website, I'm going to go over these last two links, publications and reports, and data links. And when you hit the publication and reports, you're going to see the different topics that we have reports, data, research programs on, and that's where you can access some of those reports. And that's what that looks like. When you go to and hit the data link, you're going to get a page that looks like this. We have the ability to take requests if you're looking at overdose primarily. Information, and that, as you can see, is at the top of the page, and that is KIPRC, K-I-P-R-C, requests at uky.edu. You can also find our county profiles for overdose information, and I'll go over that in a second and give you an example of that. Here's our also our occupational safety and health information, and our community injury profiles for hospitalization and emergency department for all injury. But you also see some other links down here. Here's CDC Wonder and Whiskers, links out to Highway Traffic Safety, Operation Unite, Casper, and other folks that we partner with. This is what our Overdose County profile reports for hospitalization and emergency department look like. We have these available for all 120 counties. They are the actual numbers and incidences of these areas, overdose trends, ED visits, hospital admissions between the years of 2012 to 2016, and we are getting ready to update those for the next year and adding 2017. Counties are using, we're getting a lot of feedback that counties are using these in their needs assessments and planning purposes, and so we wanted to be able to show you where you could find those, because they also have incidences of HIV, Hep C, and endocarditis that present in those counties. Going to the publication and reports, when you hit on that, this is what you're going to find, and this is where some of the reports are. And I will be very honest that we do get folks that say, we love your reports, we use them all the time, they're hard to find. And so that's this is where you're going to find most of those reports. We put out a lot of reports, and we put it out fairly often, and you'll be able to see the year released, 2018, 2017. There's many more reports included in this, and this is where you're going to find drug overdose deaths among Kentucky residents. You're going to find reports on hospitalization, multi-year reports on hospitalization, on emergency department. You're going to find Casper quarterly reports for Kentucky all prescription drug monitoring system. You're going to find some special reports about veterans and overdose, various things as you look through that. If you don't find what you're looking for, you're always free to give us a call or an email and say, what have you got and what does it look like? And so these are some of the graphics that you're going to see in some of these reports. And each graphic always has our information, where we got the data, our name, and what we really encourage you to use these for your reports, your needs assessments. Please list these completely. Don't change them. but use them. Take them, put them in your reports, leave our name attached to them so folks know where to get that information. And so you'll be able to see trend data that is Kentucky specific. You can see county data. You can see ad district, development district data, rates, trends, so lots of useful graphics for your reporting systems. We also have the Drug Overdose Technical Assistance Core for communities that are looking for some technical assistance on how to work their way through overdose prevention. And like the speakers have said before, a lot of that is working with communities to put together coalitions or assist on how coalitions put together, looking at their overdose data, looking at their injury data, and looking at evidence-based programs and working through that. So we're working with communities to help navigate through that and help build their capacity. And a lot of that is training for their epidemiologists. We can look at some sustainability planning, program planning. We do presentations on data, on overdose, on injury issues in those counties that is county specific. And so we encourage counties to give us a call. We look forward to working with strategic planning and working with boards on how to work through strategic planning and long-range plans and look at what successful coalitions are made of and what they work through. And so this kind of gives you an idea of some of the services that we help offer through prevention and promotion and reducing access to drugs and some of the evidence-based programs there. The last thing I want to go over specifically is the website findhelpnowkentucky.org. This is their latest substance use disorder treatment locator and information system. This is what the web page looks like. We are working with CDC, Unite, the governor's office to put together a treatment locator for the state of Kentucky. And with this, we've been meeting with all the treatment providers in the state to list their facility on the website so that people, when they begin to look for substance use treatment, they can go to the website, plug in the information as much as they have or as little as they want to begin to find either local or somewhere out in the state treatment that fits their needs. In this particular case, I've plugged in Hardin County, and it takes me to a web page that lists all of the different facilities in Hardin County, and that was just a general. You can put in gender, you can put in whatever specifics you want, but for just very general information. And then I clicked on Center for Behavioral Health, Elizabethtown here in the middle, and that will bring up more information about the Center for Behavioral Health. And so it will give a description, it will say whether they're accredited, that will give hours and times, it will give a map where they're at. It will also give the facility policies, whether there's smoking allowed, not smoking, because some people will choose a facility by tobacco use. What types of insurance are permitted, what types of gender identity policies are the key thing is, are the facilities actually accepting patients at that point? And all of these, the descriptors for patients, whether they're residential, medication assisted, they're all of the terms are defined and described on the website. So that gives you kind of a very quick run through. So we want to thank our partners and the behavioral health system and the drug treatment facilities for actually uploading and listing their treatment availability pretty much on a weekly basis at this point. So we're pretty excited about that. Here's how to find us, me, if you have any questions, and I'm going to turn it back over to Rochelle at this point, and we didn't have a train, but we got lucky, and so I'm available for questions after the presentation.
Great. Thanks so much, Gina. And everyone has your phone number and email address now. So if they're interested in the Find Help Kentucky Now, what's the name of that website? Find Help Now Kentucky. They can check in with you. Thank you for being on the call. And next, our final speaker this afternoon is with K-SPAN. Welcome, Steve.
Hi, everyone. My name is Steve Sparrow. I also work for the Kentucky Injury Prevention and Research Center. I serve as the program manager for the Core Violence and Injury Prevention Program that's also funded through CDC. I also serve as the K-SPAN program coordinator. Okay. A little bit about K-SPAN. K-SPAN consists of over 800 individuals, professionals, and that represent over 100 organizations interested in injury and violence prevention. We hold quarterly K-SPAN meetings. We have focused injury prevention committees. Those injury prevention committees worked on our Kentucky State Injury Plan. We would invite you to join some of our injury prevention committees. We also host a K-SPAN website, and we send out K-SPAN newsletters. During the quarterly K-SPAN meetings, we provide an opportunity for people to network. The people coming to the K-SPAN meetings are typically from state agencies, nonprofits, from across the state, local health departments, and individuals interested in injury and violence prevention. At our last K-SPAN meeting, just to kind of give you an idea of the attendance, we had around 85 in attendance. We provide diverse speakers on violence and injury prevention topics. In the first year of our grant, we had 14 educational presentations during our quarterly K-SPAN meetings, and in year 2, we've already held 2 quarterly meetings with 9 educational presentations. Our next quarterly K-SPAN meeting will be held on May 30th, which is just around the corner. It's at the Kentucky Association of Counties, who've been generous enough to allow us to use their meeting space. We can hold up to 150 people at that location. If you'd like to register, it is free. You can go to our website, www.safekentucky.org. You can register there. We do offer a modest meal and a good speaker. Our speaker for the May 30th meeting will be from the Attorney General's office, Allison Taylor, and she'll be talking about human trafficking. We'll also have Dr. Bada from Maternal and Child Health at the Kentucky Department for Public Health, and she'll be talking about pediatric abusive head trauma and also neonatal abstinence syndrome. So we hope that you'll, and I'll also have some other speakers. We'll be looking at holding a session for our Kentucky Safe Communities Network. That network is made up of accredited safe communities in Kentucky, and we'll be sharing information. That'll be right after lunch. So if you're interested in joining us, we hope that you will. Our other meeting times or times and locations is the same, except it'll be on August 16th for our 3rd K-SPAN meeting and November 21st for our 4th quarterly meeting of this year. As I mentioned, we do have the K-SPAN website. There you will also see injury data available. The injury community profiles are also available there. They are a little bit dated at the moment. We're working through the ICD-9 to ICD-10. Once that's been worked out, we will be updating those community injury profiles for all 120 counties. On that same site, you can see data for inpatient hospitalizations related to falls. And again, you can look at that for any county in Kentucky, all 120 counties, and see how many older adults have fallen that resulted in an inpatient hospitalization. We also host the Kentucky Safe Aging Coalition website. KSAC. It's called nofalls.org. Published there is also a Kentucky Falls brief. And then we also provide information about a CDC program called STEADY, which is Stopping Elderly Accidents, Deaths, and Injuries. I should go back and talk a little bit about our highway safety. If you go to that tab, we do have funding available to support a evidence-based program called Checkpoints. It's a parent-teen driver agreement. Our goal is to reach 10 counties with this pilot project and 20 high schools. We'll be able to offer $1,000 for each high school. It'll be on a first-come, first basis, and if you are qualified. To be qualified, you have to be one of 61 counties we've identified as being at the highest risk. If you go to that tab, you can pull down the application and see if your county does qualify for this funding opportunity. Also available on the K-SPAN website under the tab, The Plan. This is Kentucky's Injury and Violence Prevention State Plan. This plan was developed by our committees within K-SPAN and also under the approval of the Kentucky Department for Public Health. We are a bona fide agent of the Kentucky Department for Public Health, so we do work very closely with them. Also, as I mentioned, the Injury tab and then the Highway Safety tab, where you'll find information about checkpoints. One of our K-SPAN partners, the Kentucky Safety and Health Network, that is really dealing with more occupational safety and health issues, holds a 34th Annual Governor's Safety and Health Conference and Expo, which is going to be held this year at the Sloan Center in Bowling Green. It's from May 8th through the 11th, 2018. And during that time, we hold a health, wellness, and safety fair, and it is completely free. The board provides the booths for that fair completely free to the vendors. We still do have booths available. If you're interested, you can go to the K-SPAN website, and if you scroll down on our homepage, you can find the same information, the invitation letter, and also the application. All you need to do is just send me the application and have it filled out, and then we can set you up in one of the booths. We'll have 33 booths this year, and I still have, like I say, a couple still left. So please, if you're interested, contact me, and we'll put you in one of those booths. Also, we would invite you to join K-SPAN. It's completely free. There's no charge for joining K-SPAN. You can either email me, steve.sparrow@uky.edu, or you can go to the K-SPAN website, www.safekentucky.org, and register on that website, and that will automatically have you join K-SPAN. So currently, like I said, we have over 800 members in K-SPAN. And Rochelle, I think I did mine a little quick, but I probably talked a little faster than I had when I practiced, but I'll turn it back over to you.
Great. Thanks so much for sharing all the great work of K-SPAN and your organization. A free booth in Bowling Green at the Safety Fair. I've attended a number of K-SPAN meetings as well. It's always a great in-person meeting to connect with others who are doing work from all parts of Kentucky to share ideas, and I always learn something new at those K-SPAN meetings. So I want to thank our presenters, Melody Nall from CEDIK, Sarah Erzman Patrick from Kentucky State Data Center, Gina McKee from Kiprick, and Steve Sparrow, who you just heard from K-SPAN. As promised, we shared these free health resources. You saw everyone's data website, but most importantly, you heard from them specifically. There's a lot of work that we're all doing to improve health in Kentucky, and where we can reach out to each other and help each other do that work, we can move ahead in improving health for all Kentuckians. I do have a request. In just a few minutes, I will send you a post-event survey. Please take time to give us your feedback on today's webinar, suggest future trainings for other Health for a Change webinars. I'm open to all of your ideas. It only takes 3 minutes, and then you can go outside and hopefully enjoy the sunshine in your neighborhood later this afternoon. Again, my thanks to all the speakers today. A reminder to everyone that the website and a recording of this webinar, the slide decks will be posted to our website, healthy-ky.org. I welcome your ideas on Health for a Change. This is for you, for all of us who are working to improve health in Kentucky. And so any ideas you have for a webinar or workshop, or if you want to share what you're doing on improving health in Kentucky, I welcome that. Please feel free to email me or call me directly. Thank you for joining us this afternoon. We're jumping off the call just a few minutes early because all of our speakers share their information with us in such a timely fashion. Again, if you're interested in learning more about what the Foundation is doing and being on that list for future Health for a Change trainings, just check out healthy-ky.org where you can join our e-newsletter free of charge. Thanks everyone for being here to learn about the free health resources in Kentucky. Maybe I'll see you in Muhlenberg County or Clark County coming up in May. Again, that's also a free training. We'd love to see you there. Thanks everyone for being on the call. Have a great afternoon.
Thank you. That does conclude today's presentation. Thank you for your participation.